Hey there! Have you ever just gone in for a routine blood test, thinking it was just another item on your to-do list? Sure, most of us have, especially when we're in our golden years, in our 60s, 70s, or even 80s. Those regular checkups are incredibly important to staying healthy. But what if I told you that the little things you do right before your blood draw could be completely skewing your results? A small oversight like that fragrant cup of coffee you sip in the morning, a missed pill, or even a brisk walk around the neighborhood could lead to a misdiagnosis, unnecessary worry, or worse, a treatment plan that's completely inappropriate for your body. By the end of this video, you'll know exactly what to do and what not to do. Do to ensure your results are completely accurate, giving you and your doctor the clearest view of your health. And trust me, you'll want to look at mistake number 10. It's a major one that most people overlook, and it could really save you a big headache in the future. 1. The most common mistake: not fasting properly. You know, it's funny how we often think we've got this fasting thing down. Most of us will tell the nurse or doctor, "Oh yes, I fasted. Nothing to eat or drink for 8 hours." But then, when we dig a little deeper, it turns out that nothing sometimes includes a steaming cup of coffee first thing in the morning, maybe a herbal tea with a squeeze of lemon, or even a breath mint or a stick of gum on the way to the lab. Sounds harmless, right? Well, let me tell you, it's a game changer, and not in a good way. Here's why. In plain language, anything with flavor, even if it has no calories, can actually wake up your body. It sends signals to your system, kicking off the release of insulin and adrenaline. Think of it like a little switch being flipped inside you. When we're younger, our bodies are pretty quick to handle these small changes. But as we get a little older, our bodies just don't process sugars and other substances as swiftly as they used to. That small hint of flavor, that little bit of lemon in your water, can cause your fasting blood sugar, insulin levels, or even your triglycerides to dance around and give a picture that isn't quite true. These aren't just numbers on a page, they're critical for understanding your metabolic health. A false reading could lead your doctor to worry about pre-diabetes or high cholesterol when you don't actually have it, potentially leading to unnecessary follow-up tests and treatments. Medical studies, the kind that real doctors like me look at every day, have clearly shown that even something as simple as sugar-free gum can cause subtle yet significant changes in these numbers. I remember a kind gentleman, Mr. Arthur, a meticulous 78-year-old. He was so careful, insisting he'd fasted perfectly. But after a little chat, he remembered chewing on a tiny bit of lemon peel to curb his hunger. His triglyceride levels shot through the roof. We had to redo the test, and sure enough, his numbers were perfectly normal the second time. It was a good lesson for him and for me about how those little details truly matter. So, here's the straightforward solution. During your fasting window, typically 6 to 8 hours before your blood draw, only drink plain, pure water. Nothing else. No coffee, no tea, no lemon water, no breath mints, no gum. Keep it absolutely, truly clean. Please, stop that habit if you're doing it. It's far more important than you might realize for getting an accurate result. If you're committed to only drinking plain water when you fast, go ahead and type "clean water" in the comments below. I'd love to see you commit to your health. 2. Mistake number 2. Skipping essential medications. Now, here's another common trap I see folks fall into. Many patients will tell me, "Doctor, I'm going for my blood test today, so I thought it best not to take my medicines. I want the results to be pure, you know, not affected by the pills." But, my dear friends, this is one of the biggest misunderstandings out there. Let me explain why this can be so detrimental. Your daily medications, especially those for your thyroid, heart conditions, blood pressure, or even your mood, are prescribed to keep your body in a stable, balanced state. Skipping just one dose can throw that whole system into a bit of a wobble. Think of it like a finely tuned clock. If you miss a beat, the whole rhythm can go off. As we get older, our bodies thrive on stability. Missing a medication, even for a morning, can cause your lab numbers to jump or drop, not reflecting how your medication is actually working, but rather showing an abnormal state that isn't really you. For instance, skipping your daily dose of a thyroid pill like levothyroxine could falsely lower your TSH value. This might lead your doctor to think you need a lower dose when, in reality, your current dose is perfect. Or it could just leave you feeling anxious that your condition is acting up again, or that your medication isn't working. Every medical expert across America recommends sticking to your daily medication schedule unless your doctor explicitly tells you otherwise. This isn't just a suggestion, it's a crucial part of getting an accurate snapshot of your health. I recall a patient, Sarah, a vibrant 68-year-old. She manages her high blood pressure diligently. One morning, she forgot her pill before her blood draw, and her electrolyte results came back slightly out of whack. It took us an extra day of calls and another lab visit to figure out it was just that forgotten dose. All that hassle, all for one missed pill. So the clear and simple solution is this. Always, always ask your doctor, which of my medications should I continue to take on the morning of my blood test, and which, if any, should I temporarily hold? If you're ever unsure, just bring a list of all your medications with you to the clinic or lab. The phlebotomist or nurse there can often give you general guidance or clarify with your doctor. Please, don't just guess or assume it's better to skip your meds. A quick conversation with your doctor can save you a lot of unnecessary worry and confusing results. Mistake number 3. Getting your blood work done when you're sick or run down. Now, let's talk about those days when you're feeling a little under the weather, maybe a mild sniffle, a bit of a runny nose, or you just had a rotten night's sleep, and you think, oh, I'll just push through and get my blood test done. I don't want to reschedule. My advice to you, dear friends, don't do it. Here is the simple science behind it. Even a mild cold is a small battle happening inside your body. Your immune system is working hard to fight it off, and this effort can actually change the numbers in your blood. As we age, our immune systems tend to react a little slower and take longer to bounce back. So, a simple cold or a flare-up of allergies can temporarily raise your white blood cell count, ferritin levels, your SED rate, and CRP, those important inflammation markers. It can even nudge your blood sugar and cortisol levels up. These aren't reflecting your normal, healthy self. They're showing the stress your body is under. I've personally seen patients with sky-high inflammation markers, only to find out they were just coming down with a cold. This led to unnecessary worries about serious autoimmune diseases, extra tests, and a lot of emotional distress for them and their families. Medical guidelines universally advise waiting until your body is fully recovered before testing for inflammation markers or other values that can be affected by illness. It's about getting a true picture, not a distorted one. Not long ago, I had a patient, Mr. George, an active 82-year-old. He came in with a blood test showing a surprisingly high CRP, an inflammation marker. I was almost ready to send him for a whole battery of specialized tests for autoimmune conditions. Thankfully, when I asked a few more questions, he mentioned he'd had a nasty head cold for about a week. We rescheduled the test, and a week later, everything was back to normal. You see, a seemingly small thing like a cold can send you on an expensive and worrying wild goose chase if you're not careful. So, the practical solution is this. If you're not feeling quite yourself, even just a little bit, please pick up the phone and reschedule your blood test for 5 to 7 days later. Wait until you feel completely back to your normal self. Listen to your body, please. Don't push through and risk getting misleading results and unnecessary anxiety. If you found this surprising, go ahead and type "wow" in the comments below. It really can change your results. Mistake number 4. Taking supplements that interfere with results. We all want to look and feel our best, especially as we get older, and many of you take vitamins and supplements with the best intentions. You think, it's just a vitamin, how could it hurt? But sometimes these very supplements can actually mess up your blood test results without you even knowing it. Let's break down the science simply. Some supplements, like biotin, which many of you take for healthy hair, skin, and nails, can actually blind the lab machines. They make the machines misread crucial markers for your thyroid, or even your heart. They interfere directly with how the equipment functions. As we age, our body's ability to process and eliminate supplements can slow down. This means they might linger longer in our system and have a stronger, more prolonged effect on those important blood numbers. Imagine biotin making your thyroid TSH look perfectly normal, when in reality, your thyroid isn't quite up to par. Or it could falsely elevate a heart marker called troponin, leading your doctor to order unnecessary cardiac tests, causing a lot of worry for you and your family. The U.S. Food and Drug Administration, the FDA, has even issued warnings about biotin's interference with certain lab tests. This is a serious issue that affects many people. I had a wonderful patient, Ms. Eleanor, a spry 70-year-old who's always on top of her health. She came to me with some questionable thyroid results. We were quite puzzled until she casually mentioned she was taking a high-dose biotin supplement for her hair. We had her stop the biotin for a few days, and lo and behold, her thyroid results came back perfectly normal. You see, that simple little detail made all the difference. So, here's what you need to do. Stop taking all your supplements 2 to 3 days before your blood test. If you're on a high dose of biotin, especially over 5,000 micrograms per day, you'll want to stop that biotin supplement at least 72 hours. That's 3 full days beforehand, just to be safe. Always, always tell your doctor about everything you're taking, even those vitamins and supplements. We need to be open and honest with each other to give you the best care. 5. Mistake number 5. Not being hydrated enough. Now, this one might sound small, even trivial, but not drinking enough water can turn your blood draw into a real battle for both you and the nurse. And yes, it can skew your results too. Here's the simple science. When you're dehydrated, even slightly, your blood becomes more concentrated. This doesn't just make your veins harder to find for the nurse, making the stick more difficult, but it also affects numbers like BUN and creatinine, which tell us about your kidney function, and hemoglobin, about your red blood cells. These numbers become artificially elevated, painting a picture of ill health that isn't quite true. As we age, our thirst mechanism often isn't as sharp as it used to be, so it's easier to become subtly dehydrated without even realizing it. That slight dehydration might not show obvious symptoms, but it's enough to throw off your lab results. If you're dehydrated, your kidney function numbers might look worse than they actually are, leading your doctor to unnecessarily worry about your kidney health or suggest further tests and treatments you don't need. Medical guidelines consistently emphasize the importance of staying well hydrated before blood tests. It ensures accurate results and a smoother, more comfortable experience for everyone involved. I have a fantastic nurse at my clinic, Brenda, who always jokes, "Dr. Rice, the patients who drink plenty of water make my job so much easier." I remember one time, a patient named Mr. Frank, a kind 75-year-old, came in looking a little tired, and his creatinine results were a bit high. It turned out he'd completely forgotten to drink water that entire morning. A big glass of water before a blood test can truly work wonders. So, the practical solution is this. Drink plenty of water the day before your blood test. And then, on the morning of, drink about 16 ounces, that S2 regular cups, of plain water about 20 to 30 minutes before you head to the lab. It's a simple step, but it makes a huge difference. Make staying well hydrated a simple habit for smoother blood draws and more accurate results. Your body will thank you for it. 6. Mistake number 6. Not disclosing all your medications. Now, this next one is a bit of a funny story, though it can get pretty serious. It's when patients are taking all sorts of medications and their doctor has no clue. Then the results come back, and both sides are left scratching their heads in surprise. Here's the simple science. There are hormones, peptides, and other substances you might be getting online or from specialized wellness clinics. Things like testosterone, compounded thyroid medications, or injectable weight loss medications like semaglutide. These can profoundly affect how your body works and how your lab numbers are read. The core why is that, with age, our bodies can react differently to synthetic hormones or complex compounds. Not knowing about these can lead your doctor to make incorrect assumptions about your overall health, leading to inaccurate decisions. For example, I've had patients using testosterone they bought online. Their blood tests showed their red blood cell count was through the roof, which made me worry about serious conditions like blood cancer. It wasn't until I pressed further that they finally admitted what they were taking. You see, an honest conversation can prevent an unnecessary adventure through endless tests and a lot of needless panic. Medical associations across the country strongly recommend that patients be completely transparent about all medications they're using. This is crucial for safety and effective treatment. I recall a patient, Ms. Susan, a lively 65-year-old, who was taking a peptide for weight loss that I wasn't aware of. Her blood sugar and liver enzyme results came back looking a bit off and didn't quite match what I expected. Once she told me about the peptide, everything clicked into place. A single truth can save so much time, effort, and anxiety for both sides. So, the solution is straightforward. Be completely honest with your doctor about all medications, supplements, or hormones you're taking, even those you buy online or from wellness centers. Even if you think it's irrelevant, just mention it. Please, think of us as your trusted friends in health. An open conversation is key to getting the best care for you. Don't be afraid to share. 7. Mistake number 7. Intense exercise on the morning of your blood test. You're an active person, always wanting to stay in shape. That's absolutely fantastic. But a vigorous workout on the morning you are rescheduled for a blood test can surprisingly muddle your results. Here's why. Simply put, intense exercise temporarily raises certain substances in your blood. Things like creatinine and creatine kinase 1 look like muscle damage or kidney disease. It also affects liver enzymes, making them appear elevated, and can even bump up your blood sugar and cortisol, your stress hormone. As we get older, our bodies take longer to recover after strenuous activity. These temporary changes linger longer in our blood, skewing the results and potentially confusing your doctor. The consequences: your doctor might think you have kidney problems, liver issues, or even prediabetes, when in reality, it's just because you broke a sweat too much that morning. This can lead to unnecessary follow-up tests and a lot of undue worry. Numerous studies have consistently shown a significant rise in these markers after intense physical activity, impacting the accuracy of lab tests. I remember Mr. David, a fit 62-year-old recreational marathon runner who always made sure to get his morning run in. One time, he went for a 6-mile run right before his blood draw. His liver enzymes and creatinine came back abnormally high. We had to retest, and everything was perfectly normal. He learned his lesson about taking it easy on blood test day. So, here is the practical solution. Avoid strenuous or high-intensity exercise on the morning of your blood test. A gentle walk is absolutely fine, but save that HIIT workout or long run for after you've had your blood drawn, okay? Give your body a little rest. Think about calming your body down a bit on a blood test to get the most reliable results for yourself. 8. Mistake number 8. Eating a heavy, fatty meal the night before. Do you ever think, oh, as long as I fast in the morning, I'm good? Well, I have to tell you, what you eat for dinner the night before can also subtly sabotage your blood test results. Here's the simple science. A heavy, fatty meal, think a rich lasagna or a big juicy steak with all the fixings, takes a long time for your body to digest. Even if you fast for the recommended 6 to 8 hours the next morning, those fats can still be hanging around in your bloodstream, falsely elevating your cholesterol and triglyceride levels. The core reason for this, especially as we age, is that our digestive systems often work a little slower. Our liver also needs more time to process fats. So, the lingering effects of that dinner can extend further into the morning than they would for a younger person, causing distorted results. This is particularly crucial if you have a higher risk of heart disease or metabolic syndrome. A skewed lipid panel could lead your doctor to unnecessary concerns, or even change your medications when it's not truly needed. Many studies have clearly shown that a high-fat dinner can indeed skew lipid profiles the next morning, even with proper fasting, because the metabolic process is still ongoing. I remember Mrs. Mildred, a delightful 70-year-old who loved to cook, had a rather lavish dinner of BBQ ribs and French fries the night before her test. The next morning, her triglyceride levels were through the roof. After we asked her to eat a lighter dinner and retested, everything came back perfectly normal. Clearly, that delicious meal caused a little unexpected trouble. So, the solution to this is, on the night before your blood test, aim for a lighter dinner. Focus on low-fat, protein-rich options with a moderate amount of carbohydrates. Think of a grilled chicken salad instead of a large pizza, okay? Give your body a restful night before that important blood test to get the most accurate results. If you'll try a lighter dinner, type light dinner below. I'd love to know you're making that change. 9. Mistake number 9. Getting blood work done too soon after a medication change. This is a mistake I often see in my patients who are very proactive about their health, which is a wonderful thing, but they're also eager to see results right away after a medication change. Here's the simple science. Your body needs time to get used to a new medication or a new dosage. Think of it like a machine that needs time to warm up and run smoothly. Medications also need time to fully take effect. The core why is that with age, our body's metabolism and response to medications can be slower. A new medication often requires several weeks to truly reach its full therapeutic effect and stabilize those crucial blood numbers. The consequence of testing too soon? The results might show that the medication isn't working as well as expected, causing you unnecessary worry and potentially leading your doctor to adjust the dose too soon. In reality, the medication might be working perfectly fine, but your body just needs more time to adapt. This can lead to unnecessary medication changes. Standard medical protocols often recommend waiting 6 to 8 weeks before re-evaluating medication effectiveness through blood tests to ensure the most accurate picture. I remember Mr. William, a 73-year-old, whose statin medication for cholesterol had just been adjusted. He wanted to get retested after only 2 weeks. His cholesterol numbers had only dropped slightly, and he was quite disappointed. I advised him to be patient and wait another 6 weeks. And guess what? The follow-up results were absolutely fantastic. His cholesterol had significantly improved. Sometimes, patience truly is key. So, the practical solution here is always ask your doctor, how long should I wait before rechecking these labs after a medication change? For most medications, the waiting period is about 6 to 8 weeks, maybe a little longer depending on the specific drug. Give your body and your medication the time they need to work. Don't rush it. Good health takes time. 10. Mistake number 10. Getting your blood work done the day before your doctor's appointment. I'm truly happy when you're proactive about getting your blood tests done. But getting them done too close to your doctor's appointment can actually prevent us, your doctors, from having all the information we need to help you best. And this, my friends, is that diamond mistake I promised to reveal. Effective medical practice requires that doctors have ample time to review your results before meeting with you to make your appointment as productive as possible. I remember Brenda, a diligent 58-year-old daughter of an elderly patient I was seeing. She took her mom for blood work on a Monday, and they had an appointment with me that Wednesday. But some specialized tests needed 3 or 4 days to come back. When they arrived, I only had half the crucial information. I couldn't give them a full picture or comprehensive advice. We had to reschedule another visit to discuss everything fully. What an inconvenience and delay for the whole family, all because of a little lack of planning. So, the clear and simple solution is schedule your blood work at least 5 to 7 days before your next doctor's appointment. This ensures we have plenty of time to receive, review, and thoroughly prepare to discuss everything with you most effectively. Think of it as doing your homework for your doctor's visit, so we can work together as efficiently as possible, and you always get the very best advice. It could be as simple as, I will only drink purified water before my test, or I will be honest with my doctor about all my medications. Or it could be, I will schedule a test before my doctor's appointment. Whatever it is, please share your personal commitment in the comments below. Let's inspire each other to take the first step, no matter how small. And if you truly found value and inspiration in our time together, please show your support by giving this video a like. It lets me know I'm creating content that's truly helpful to you and helps our channel reach even more people who need it. To make sure you continue this journey with us and never miss another video filled with life-changing knowledge, please subscribe. This isn't just a subscription. It's joining a community of friends who are all striving to live their best, healthiest lives. Finally, think of someone you know who needs to hear this message today. And please, share this video with them. You could be saving them from unnecessary worry, or even changing their life. Thank you so much for taking the time to watch. Stay healthy, stay wise, and I'll see you all in the next video.